really, the type of leadership you need for innovation projects like this, we needed a visionary, hands-on, courageous leadership. Because like I say, this is uncharted territory. We are going into an industry that, firstly, when we started, we had no knowledge about. We just knew that we had to do it.
Yeah.
So you needed leaderships who actually think beyond the traditional healthcare boundaries, and those that are able to imagine bold, sustainable solutions. On top of that, you needed a leadership that is competent, that is able to take calculated risks. So we needed to drive this, project with persistence and conviction. Trying to tackle the bureaucratic challenges that we have within our systems, but also keeping the bigger picture in mind. And the type of leadership you need is also a collaborative leadership that brings together a multidisciplinary team. Because this project required, different, people, engineers, scientists, procurement officers, and also external stakeholders, such as our funders. So really, you need leadership that have a long-term mindset, that knows that, innovation is no more a luxury, Aguto. We need to know that innovation is necessary. If we want to drive national development, we can no longer just be talking. We need to take the steps. And that is the type of leadership that we have at the Namibia Institute of Pathology. They took a step, and like I emphasized, this project, 80% of the funding thus far, and it's going to increase, has been funded locally by the Namibian Institute. And that is the type of leadership you need for this type of projects to take off.
Can you elaborate a little bit for us about the contribution that this makes to sustainability in our medical industry and also improving the quality?
Right. So like I say, during COVID, it was a wake-up call for us. If you're talking about building a public, a resilient public health system, you need to start taking, you need to start actually being part of the key value chain. You need to start producing, because if we are importing 100%, of all these consumables, we cannot talk about resilience. Because it means if a pandemic hits us right now, and like we saw the shutdown. If we have a shutdown right now and the pandemic hits, and we are trying to get some consumable from China, because of the shutdown, what happens? We can't. So really, building resilience means localizing some of these things. We might not, of course, because of our population, we might not be able to localize everything, but we can localize some of the essential things. So this is really us saying, let us localize, manufacturing of the test tubes, so that we can start taking control of some of these key value chains in the supply chain.
Okay. Can you elaborate for us a little bit more about the specific test tubes that you manufacture, costs, inputs, and also distribution, because you say there's an opportunity to supply SADC.
Yes, definitely an opportunity for us to supply SADC. And one of the things that I must point out is that they would be supporting us as well, especially when it comes to distribution.
Excellent.
So this is an initiative that they've already started on. Things like certification. They want to come up with a body that certify basically all these medical devices, so that we do not go through a lot of hurdles. So that's the beauty about now having this SADC community. Now, the test tubes that we'll be producing, we have a variety of test tubes in the lab. And so we've really implemented a phased approach, whereby we've decided that first we are going to start with what we call as, this specimen collection jars.
Yeah.
You know, this is usually used for your urine, stool, and then we move on to the ones that you collect for your influenza and COVID. So we really have a stepped approach on how we're going to do this so that we can reduce our imports.
Okay.
Yeah.
Back in the day when I was in school doing science, those test tubes were always made of glass. Are yours still made of glass? And the glass is most silicon, sand. We've got a lot of sand. Are we able to supply your medical grade inputs?
Good thing you're going into like really deep technicalities, which I really like, because the question has always been, Africa has all these resources, right?
Yes.
And are we going to be getting our raw materials from, Namibia?
Yeah.
That is where we would want to be one day,
Okay.
definitely. The tubes that we're starting off right now is they are made of what we know as PET, which is a type of plastic,
Okay.
and it's of course medical grade. And currently, we would we're being supplied by the Asian market. But the good thing about this medical grade plastic is that you can buy a bulk that will can last you for even 5 to 10 years, because it's a very stable material.
Okay.
So that is a good thing. But really moving forward, we would like to really explore if these raw materials, we could actually start getting them and extracting them from the continent itself, and
Yeah.
not other continents. Yeah.
Ogeto, obviously, of course, people will get nervous when the blood stock is low, but then behind the scenes, we work tirelessly, as I mentioned before, to ensure that the blood is collected, to ensure that it's processed, to ensure that it's transfused to patients that need it. So obviously, it's a lot of work to get people to come in and donate blood. And like I said, with blood donation, it's not, or with our marketing people, it's not normal sales.
Yeah.
You can't convince somebody to give their blood when they don't want to. So as I mentioned before, it's always to ensure that we get the voluntary, non-remunerated donors in to come in and donate blood. And we thank them. We really, and that's why we have our World Blood Day donor celebrations. We really, really want to thank them for always coming through and for always ensuring that we do get our blood stock back up.
Yeah.
For the patients that are in need in the hospitals.
So in those situations, do you start calling your regulars?
Of course, we have a very, very great donor recruitment system in place. And yes, we do the calls, we do the marketing, we search for the clinics that are the right clinics at that time. Yes, we do a lot when it comes to having or being under pressure.
Saturday being Blood Donor Day, it's a global thing. Do we, and you in particular, do you get support from the rest of the world? You mentioned the World Health Organization earlier. Do they support you?
Yes, well, the World Health Organization supports the Namibia Blood Transfusion, and the Ministry of Health supports the Namibia Blood Transfusion in celebrating World Blood Donor Day annually.
And do you guys work together with other countries?
Not necessarily. Not necessarily. We try to keep it to Namibia.
How would the situation in Namibia compare to, say, in SADC and the rest of Africa? Are we about on par, or
Well,
are we doing
Namibia
anything
seems
better?
to have the safest blood supply in our country.
Okay.
I mean, in our continent.
Oh,
Yeah, on our continent. Yeah,
so that's something we can take some pride in.
something we can brag about.
Yeah,
Yes.
I like that. I like that. Earlier we mentioned about the need for donors to stay healthy. Can you expand a little bit about the requirements for that, the lifestyle? And I imagine you yourself, you also try to stay healthy.
Well, with donors, a lot of our donors, of course, like I mentioned before, they try to stay healthy, and that requires a lot of ghetto. That requires leading a sexually safe lifestyle. That requires also trying or just staying committed to helping and caring for others. I mean, we also have donors who really care about what they eat, but I mean, we're not very specific about what you eat. Just as long as your iron levels are great, your blood pressure is great that day, and you don't have any of these opportunistic diseases, you're good to go.
What's an opportunistic disease?
Well, it's high-risk diseases.
Oh,
Yeah.
okay.
Yeah.
Okay.
High-risk diseases.
You mentioned that the events on Saturday and part of the drive on the day will take place in different parts of the country. Do you have offices outside of Windhoek?
Well, we have an office in Swakopmund, and we have an office in Oshakati and in Walvis Bay. So we're just not limited to Windhoek. Namibia Blood Transfusion does have offices outside of the capital city.
But the testing that you mentioned earlier, I imagine that only happens in Windhoek.
Yes, so daily, the other branches do send their blood, the blood that has been collected to the headquarters in Windhoek, and then the testing happens at our facilities in Windhoek.
Okay, so there's somebody who drives blood halfway across the country every day.
Yeah, of course there is.
That's a very interesting job.
Yeah.
Okay. Since you've joined the organization, what do you find the most fulfilling?
I just think when someone calls in and says thank you for saving my life, or thank you for saving my son's life. I particularly myself, I've spoken to many recipients before, and when they're really, really thankful and they tell you your story or their story, I think that is the most fulfilling part of it all, that we're not doing this for nothing, that we're really doing this to change people's lives, to prolong people's lives, and to make people happier.
Wow.
Yeah.
That's a wonderfully fulfilling occupation that you have.
Quite.
Okay.
Yes.
Okay, and I imagine you're quite proud of being part
Very,
of it.
very proud of being part of the blood transfusion service. Yes.
No, awesome. Okay, tell me, what are you looking forward to the most for Saturday?
Well, what we're looking forward to the most is just that we reach our targets so that people are able to have a consistent blood supply next week. Yes.
And have you set high targets?
Not high targets, but we've set what is needed.
Yeah.
Yeah.
Okay.
Yeah.
Okay. When people need the blood, like for instance, hospital or road accidents or other cases, how does the system work? How are you notified, and how is it coordinated so that the blood gets to the person who needs it?
Well, the blood banks are notified by the hospitals, and then the blood banks is the entity that actually distributes the blood to all of these medical centers across the country. So that is how blood is then received by these hospitals and then transfused to the patient.
Okay.
Yeah.
And the Namibia Blood Transfusion Service is a blood bank, or is each of your offices a separate blood bank?
No, yeah, we have separate blood banks. We have 5-6 blood banks across the country, and they are the ones that distribute to the hospitals in those regions.
So if I go and donate, my blood goes to one of the blood banks, and then from there it'll go to
A patient.
A patient.
Yes.
Okay. No, it's very interesting. I imagine there's also a lot of technology and a lot of cleanliness involved in terms
Yes,
of the science.
of course. There are very, very strict protocols to how blood is handled and how you must remember that blood needs to be safe to be transfused to a sick patient.
Okay.
Yeah, so there are procedures in place that where it has to be a clean surface area, blood has to be settled at a certain temperature. There are procedures in place.
Does blood expire?
Yes, after 42 days.
After 42 days?
Yes, after 42 days. We can only keep it for 42 days.
Okay, but that
Yeah.
seems a pretty long time. I mean, I don't think it was like that back in the day.
Yeah, well, like I mentioned before, we just had an issue last week where we didn't have enough.
Yeah.
So it doesn't reach that 42 days.
I
Because what
see.
we received or what we collect, we issue out.
Yeah.
So
And you were telling us that you've currently only got enough for 3 days.
yeah, we're currently on 3 days blood supply, and that's why we're still urging people to come out and please donate blood if they're eligible to do so.
Yeah.
Yeah.
And we're trying to get to 8 days.
8 days.
That's-
Then that's a healthy blood stock.
Okay.
Yes, yes.
Okay.
Yeah, unfortunately, this one will not cover them because it's a survey.
Yeah.
So we are looking at households. We are not going to look at special households like we did with the census where we go to them. These ones, we are strictly going to households that are selected And I must mention that it's not going to be everyone that will be visited.
Yeah.
It's just going to be a selected household that can participate. So it's not a census, it's not a full count.
Yeah.
It's just a sample-based survey.
Then you can infer the bigger
Yes.
picture from that sample.
Yes, yes.
Yeah. There's also this thing about measuring or covering children under the age of 5. Just if you can explain what that means.
Yes, so maybe let me start with some of the tools that we will be using in the field.
Yeah.
So they will have scales, measuring scales, and roller meters for height. So the reason why they are measuring kids is just to check on the malnutrition of the kids.
Okay.
We are talking about food poor. We are talking about poverty. Yeah. You have households that will tell you, no, we have not eaten for the past 3 days. So measuring the kids also will be evident enough to show that, yes, these people have not really been eating. So this is where the malnutrition can also show from the child, that the child has not been getting the nutrients that they are supposed to get at that particular age.
And I mean, sorry, this one is quite an ignorant question, but is it because malnutrition, this is the age group that is mostly affected by malnutrition, or how do we deal with children that are 6 years old, 7 years old in an exercise like this?
Yes, I think it's basically from 0 to 5 years.
Okay.
They look at those age groups.
So the scale that you mentioned, because when I just want to make sure that
yes,
when somebody rock up at my house and with these tools, so is it the scale for height or to measure also the weight?
Yes, it's the weight,
Okay.
a scale for the weight, and then a roller meter for the height.
Oh, I see.
Yes, I think we were having a discussion also to say this is a 5-year or maybe a 0-year-old child, and some people might not be comfortable with because the field staff have to do the measuring.
Yeah.
So in such a case, we can ask the mother, we can measure the mother first, and then we ask the mother to carry the child. Thereafter, we subtract the age of the mother from the total weight, then we get the weight of the child.
Oh.
Or in another instance, maybe the mother is also not comfortable, the mother can do the weighing themselves.
Yeah. So if my child is underweight and I'm a bit shy to reveal to officials that my child has not been eating, how do I navigate around that?
Unfortunately, it's something that we have to capture. If that's how the situation is on the ground, we have to capture that and report on that. I think that's the only way people can also get help. When people know that there is really a challenge, there is really a problem.
The problem in the society is sometimes the attitudinal barriers. They can make you, as a disabled child, altogether invisible because of the character flaw. At that time when we were graduating, because our leaders, the political will is there. Let us not, our government, they are doing very well. The political will is there, is doing very, very well. But the technocrats that are in there to implement these deliberate policies, they do otherwise. They do otherwise. Because our liberators or the political will, they saw to it that a child of a disability nature was not invited on the table. Because what used to happen is, if there are visitors in the village, these children used to be tied behind. They should not be seen or be heard. They are tied behind, meaning they are isolated until when the visitors go. That's when you will say, bring that one also here. Because it's like you are a curse. So by that time, after graduating, now you have got the technocrats who are there, who are also not trained to say there are people with disabilities, by the way, which we need to bring in. They are also surprised to see that can a person with disability, can the person graduate also and become somebody or challenges us on some of aspect. If you were seated on a table that is level, they could not also understand that. So I remember firmly after graduating, we started applying. Most of the teams that we graduated with, some of them when we were doing assignments, you can be the prominent person in this group assignment, even to assist. But when it came to employment opportunities, most of my team, those I graduated with, they got into the labor market. But I remember one interview that surprised me. You get in there, people are asking you a question, can this one drive a tractor? But they can see on the result there, it's even written that you are a top student in tractor and motor mechanic, farm implements. But can this one drive? How will this one go around the farm advising farmers? Will he walk? Will he drive a GRN vehicle? Those were impediments. So the moment you get in there, they start to ask you, can you drive? You realize that here is a no-go area. I don't think I'll make it. So it was a barrier.
And sometimes, I suppose, sometimes they did not even know, they couldn't tell from the application that the applicant has this condition.
Yes.
They only get surprised when you walk in the...
Yes.
Yeah.
They only get surprised. You come in, they say, how can this one on clutches say that he did agriculture? So they already have the attitude. Remember, these are the same people who had already attitude with a child who is disabled. From wherever they come from their village, they had the attitude already. They've seen that these people were treated differently, so we cannot treat them, I think a disabled child was close to those ones who were treated with leprosy. The only difference is those ones were now taken out of society into some small houses somewhere outside. But you were still within your family, within your society, but you are tortured while still there. Because people get tired of you. They need to bring for you water. Maybe you cannot fetch your own water. They get tired of that charity. So generally, disabled kids were dirty because you cannot do some of the things by yourself. So I could not penetrate that market, though I was a graduate.
I'm curious as to, obviously you have a job now, and of course we're not going to say where you work now, but I know that you have a very, very important job right now in one of the pension fund industry. But what was your first job? I'm curious about what must have been your first job.
Yes, my first job, I applied those which I wanted to get, but I could not penetrate the labor market. So I had just to wallow to be in the city of Windhoek, trying to look for chances where you can get a job. And I bumped into various ministries. At that time, the disability unity was under Ministry of Lands. I think under Pendukeni at that particular time. So one minister at that time was the Minister of Education. I bumped into that minister, into his office. I think it was Minister Nahasangula. But it's a long time. They won't remember this. I bumped into that office. And he said in his common, because he was jovial that morning. Because I just bumped into the office. The secretary was so nice to say, oh, you want just to say hi to the minister? Oh, come in. Then what do you want? Yagbe, you want a job? But you are disabled. Go to Pendukeni. Your thing is under. Then that's when I went there to Minister of Lands. And then when I got there, Then I went into that section which was managing the affairs of people with disability. I remember the custodian lady there by name, I think it was Miss Juliet Mupurwa, if I pronounce the name very correctly. Yeah, I sat with her. She said, "Oh, I saw you, young man. You graduated." I said, "Yes, it's me." Then he said, "Right, take your qualification to Okulyengawa." There was a disability center there. Yes, so I took my papers there. You know, these centers, they just need more support. They are doing a lot. They just need more support from the technocrats within the institution. So I took my documents there. And where now I find myself to where I am working is, I don't know what came in the mind of that CEO who recruited me. It has to take the whole CEO to leave his comfortable office to drive to Okulyengawa to say, I am looking for people to employ even 1 or 2 people with disabilities. Went there, I don't know the person. He went there to grab some forms there. He chose some few forms there. That's how I was called to come and work to where I am today. It has to take the whole CEO. Because if it was not a CEO, I could not have been there. Because the technocrats, they will always block you. But because the custodian was the CEO, he made sure that the policies of government, they are also adhered to and implemented. Thank you.